So this tooth, unfortunately, is a goner. It just cannot be saved. So what we're gonna try to do is we're gonna take this tooth out and we are going to put a dental implant in its site. Now you can tell there's a ton of decay on this tooth, and I'm always shocked that the patients cannot feel this because you can see the nerve right here. The nerve is very, very close to the surface, and I'm always shocked the patients cannot feel this. Now what we're gonna do is we're gonna take this tooth out. Of course, you're gonna be numb for this, and we're going to bone graft it. We're gonna put artificial bone in there. Your body is going to take a hold of this. Then we're gonna wait 3 months, and we're basically gonna flap the gums. That's another. Flapping the gums, of course, you're gonna be numb for this. We're basically gonna take the gums and we're going to take a look at the bone, make sure the bone is healed, and then it's actually really strong to place a dental implant. Now, placing a dental implant, what we're gonna do is we're gonna take these drills and we're going to take a pilot hole and we're going to drill an osteotomy. And osteotomy is basically a fancy word for hole in your bone. Now we're gonna take these drills and we're just going to widen this osteotomy, which is that hole, a little bit more and more and more. Now when we take your dental implant to put it inside here, we're going to take a diameter that is slightly bigger than the hole that we drilled. Now it's gonna be the same depth, but the hole is actually going to be a little bit smaller than the implant because we wanna have a specific torque to put that dental implant in there. Now this dental implant, looks like a titanium screw you get from the hardware store. A lot of people refer it to that, and I always agree with them, except this is like a $500 implant, which is why dental implants are so expensive, because it costs us $300, $400, $500 as dentists. There's really not much we can do about that cost, unfortunately. So then we're gonna take that dental implant, we're gonna put it in there, we're gonna get our torque, we're gonna make sure that it's really heavily grabbed by the bone, and then we're going to put a healing abutment. Now, a healing abutment is basically like a man cover, like a hole cover. Basically, we're gonna put over it. We always call this a button. I'll call this a button for patients because that's what it feels like to your tongue. It feels like you're actually just have like a little button that your tongue can lick and feel, and it takes a couple days to kind of get used to that feeling. And then we're gonna suture it up and we're gonna let that heal a little bit more. Now we're gonna uncover that and we're gonna put what is called a coping on here. Then to restore that dental implant, what we're gonna do is we're going to put an abutment on here. An abutment is an intermediate part between the dental implant and the actual crown, which gets a little bit confusing, especially when we're billing patients. What is an abutment? Why do we have to do this? Why is the lab taking 3 weeks to make my dental crown? And it's because we have to make this little titanium abutment. Now, unfortunately, one of the things about this is that this is a cement retained restoration. Now, we don't want to do this as dentists. We always want to do a screw retained restoration because basically a screw retained restoration, there's a little hole in the top of the crown and we just screw it in and then we put a little filling material into the hole of the crown. That is a screw retained restoration. The reason that's better than a cement retained, like in this video, is that you can retrieve it anytime you need. So sometimes patients will have a little screw that's loose in their implant, and then we'll unscrew that, we'll take off the covering, we'll torque it down, we'll reassess the crown, we can clean underneath there, and we're gonna put it back. So it's basically got like a Lego piece that's locked in there. We can unlock it and take that off and then replace it if we need to replace a crown, if we need to clean underneath there, take the restorative screw, whatever we need to do, we can actually replace that because it's screw retained. Unfortunately, they decided to do a cement retained one, which is okay. Sometimes because of the angulation of the implant, we have to do that. That's the only option that we have. And essentially we take this, we plug it, we put a filling in there. This is Teflon tape, that little white tape they use is Teflon, and they seal it off, and then we take cement and we just glue it in there. The reason we don't like to do that is because it's not very retrievable. Number two, the implants do not like the glue. You do not want that glue getting down into your implant because it is a known cause of failure of dental implants. So anytime that you have cement touching the implant, it is bad news. It is a no-go. We don't want to do that. If we can do screw retain, we do that. If we have to do a cement retain, sometimes, usually on the front teeth, if we do implants on the front teeth, they have to be cement retained just because of the angle of the dental implant. So if your tooth looks like this, even though it doesn't hurt, or maybe it does look like this and it does hurt now because it has an infection, now you know the whole process of what to look for and how you're going to get that tooth out, how you're gonna fix it with a dental implant. Now, one last thing I wanna talk about is that you do not wanna do a dental bridge in this case. If you can afford a dental implant, it's much more conservative for you because the adjacent teeth need to be drilled down to do a dental bridge. Now, if you already have crowns on there, that's one story, but it is really, really nice in this situation that this patient is going to get a dental implant because you don't have to drill on the teeth adjacent to do a dental bridge. So if you have pristine teeth next to the missing tooth, a dental implant, you're just a 1-to-1 ratio. You're taking out one tooth, you're replacing it with one tooth, and that's why I like to do dental implants in this situation. But I would probably do screw retain in the future instead of cement retain, just a minor little detail. I'm glad you like watching this video. I'm just a dentist. If you had this happen to you and you literally had this happen in your mouth, let us know your experience on how it felt, what it looked like, how much it cost, whether you thought it was worth it to do a dental implant in there versus just leaving the space, which I do not recommend at all. And I'm just a dentist. Thank you for watching.